Is the information all over the internet confusing you as you try to figure out what Medicare supplement plan is right for you? Have you called into one of those celebrity endorsed 800 numbers and received nothing more than a pushy sales pitch? Are you finding conflicting information and not sure where to turn? Stay tuned for some unbiased breakdown on how to choose the right Medicare supplement plan for your individual needs. Hi, I'm Jay Rail of TLC Insurance Group, Senior Healthcare Specialist helping people with all things Medicare. I help people all over the country determine the right plan for you by really looking at your individual situation and helping pinpoint the plan that's the right blend of benefits and cost for your individual needs. Also, my services are always 100% free. It'll never cost you a dime for questions, consultations, or enrollment assistance. If you like what you hear today, click that little thumbs up button down there in the corner, or subscribe to get ongoing new videos as we post them. All right, so let's get started. When it comes to Medicare, you have 4 options or choices of how to get your Medicare. First is to only have original Medicare, just your Part A and B. I do not advise this. Medicare by itself has a lot of holes. With just original Medicare, you're exposed to a hefty Part A deductible if you're admitted even for 1 day into the hospital. You are also responsible for 20% of all Medicare Part B costs. 20% doesn't sound like much if you're talking about a $100 doctor visit or $200 in labs. But let's say you had a $50,000 outpatient surgery. What happens if you're diagnosed with cancer and have $500,000 in chemo and radiation treatments? Original Medicare doesn't give you an out-of-pocket maximum or a dollar amount that you cannot exceed in any given year. 20% could easily bankrupt you, or at very least destroy the savings that you've worked so hard for during your working career. The good news is the other 3 options that we'll take a look at all give you caps. So if option 1 really isn't an option, what are my other choices? Well, some people are lucky enough to still be offered health insurance through their current or a former employer. If this is you, frequently it is still a good idea to take a look at the next 2 options. Some retirement plans are beyond fantastic, but not all are. You might be paying a few $100s a month, or have a sizable deductible that you have to pay each year before your benefits really kick in. Your current or former employer may be giving you the option to stay on the same plan that all non-Medicare eligible employees have. In many cases, especially with larger employers, when this is the case, you may not be maximizing your Medicare benefits, which results in you paying higher costs or getting fewer benefits than you're really entitled to. It never hurts to compare your options. We can usually figure out within a matter of minutes if your group retirement plan is worth keeping or if you should take a closer look at other options. The next path you can choose for your Medicare is the Medicare Advantage route. These are going to be the plans with no monthly premium or a smaller monthly premium. In exchange for your monthly savings, you have more cost sharing in the form of copays and or coinsurances for services you receive. We will look at these type of options more in depth in future videos. The last option to look at is a Medicare Supplement or Medigap Plan. Today we are going to dive into the Medigap Plans, which ones are the most popular, and why you would want to choose them. Medicare Supplements or Medigap Plans are the plans you hear of with the letters Plan F, Plan G, N, B, C, and so forth. These are not the same as the parts of Medicare, parts A, B, C, and D. A little confusing, I know, but let's keep going. There are literally hundreds of insurance companies out there that offer these kinds of plans. You can get a supplement with the big household names like AARP through United Healthcare, Humana, Aetna, Cigna, Blue Cross Blue Shield, and many more, including local and regional companies. You will even find that there are companies that you may normally think of as life insurance companies that have a huge Medicare supplement offering. With so many available, a huge question is, of all these companies and plans, how do I figure out what's right for me? Well, the simple answer is to talk to an independent licensed insurance agent. And I say independent because you want to talk to someone who doesn't just work for one company or have just one company's products. A good independent agent will be able to help you figure out the right plan and company to use based on where you live. When you use a good agent, they are your advocate. I frequently tell my clients, for me as an agent, it doesn't matter which plan you go with. I offer and have access to almost any plan you could possibly want. As long as you use me to enroll in whichever plan you choose, it works for me. As an independent agent, my job is to help you sort through all of those plans to find the one that is right for your individual needs, regardless of which company it might be with. If you find an agent that you like and trust, that can provide you with all the options, that listens to you and provides you with sound advice, you now have a one-stop shop for your Medicare needs, not just today, but in the future as well. The other beauty is you don't pay anything extra to use an agent, and you get the agent's services for free. When it comes to Medicare plans, insurance companies can't say, do it yourself on our website, or call directly into our 800 number and get an extra 5% discount. The price for the same plan through the same insurance company is the same no matter how you get it. So why wouldn't you want to have expert advice for free? You ideally want to speak with someone that is familiar with the area you live. Insurance company A may be fantastic and have great rates in Cleveland, Ohio, but that same company and the same plan may be 40% more expensive in Miami, Florida, or vice versa. So the right company can be very different depending on where you live. So without getting into what companies to use, since that's different all over the place, let's talk about which plans to use. Unlike the prices of the plans and which company to use that can vary even if you live one zip code over, the plans themselves are identical in almost every county and every state across the country. No matter where you live, a Plan F is a Plan F, a Plan G is a Plan G, and so forth. It doesn't matter what insurance company you look at, all plans will give you identical health benefits. The only thing that can vary is some plans may give you a few extras, most commonly things like silver sneakers or dental and vision discount programs. Supplements don't offer integrated dental and vision insurance, but they can offer discount programs. If a benefit like silver sneakers is important to you, make sure you bring that up when we discuss your plans one-on-one. So, like I mentioned before, unless you have employer coverage, you can get a Medicare supplement or a Medicare Advantage plan. Well, why would you go with the supplement instead of the free plan? Now, first off, I am in no way saying that Medicare Advantage plans are a bad option. And for a lot of people, they are absolutely the right fit. We will talk more about why they may be the right fit in a future video. But getting back on track, why would you want to go with a supplement? Well, first off, Medicare supplements do not have networks. The insurance company can never tell you where you can go and who you can or cannot see. If a doctor, facility, or hospital accepts original Medicare, you are free to go there and the supplement will pay the whole bill or whatever balance it is supposed to pay based on the benefits of the plan that you choose. With a supplement, you should never hear, "Sorry, we don't accept that plan." You can travel anywhere in the United States without having to worry about a network. You can see any doctor, go to any hospital, anywhere in the U.S. as long as they accept original Medicare. Second, your benefits will never change. If someone picked up a pre-standardized Medicare supplement plan back in the 1980s and never made a change, that plan will still look exactly the same today as it did the day that they bought it. If you want to pick a plan that you can pick and just leave alone from year to year, a supplement may be the right fit for you. Now, you should expect your monthly cost of your supplement or your premium to go up from year to year, and that is normal. Supplements do tend to get more expensive as time goes on, but the benefits themselves will never change. Third, and for most people the most important reason to choose a supplement, is no surprise bills. Supplements have rich fixed medical benefits And depending on which supplement plan you go with, you will have very little or no out-of-pocket cost regarding your medical bills. Whether your health is good or bad, you can rest easy knowing that no matter what the future holds, your medical bills will be very, very controlled when obtaining Medicare-covered services. If you have a bad year, in most cases you would see much lower out-of-pocket expenses with a supplement than you would with a Medicare Advantage plan. The fourth reason to choose a Medicare supplement, you have more prescription drug or Medicare Part D options. With a Medicare Advantage plan, if you need prescription drug coverage, the drug coverage will be built into the plan as an integrated benefit. But what if that plan doesn't cover a particular medication that you take very well, or worse, doesn't cover it at all? If the cost on that medication is high enough, or if it's an important medication that is not covered, you might have to change your plan altogether to fix the issue. However, with a supplement, the Medicare Part D plan is separate. You can pick the Part D plan that's available in your area that best fits your medication needs and your prescription list. The final top 5 reason really isn't quite as important in many areas as it used to be, as fewer and fewer Medicare Advantage plans are requiring these, but you will never need a referral to see a specialist. Medicare supplements don't use networks, so you don't need to assign yourself a primary care doctor that all specialists need to be referred through. If you wish to go to a specialist that your primary care doctor has no affiliation with, you can rest easy knowing that you can go see that specialist without any pushback from your insurance. Now that we've talked about what might make you choose a supplement, let's talk about the downsides to them. First off, and one of the largest complaints with supplements is the price. Medicare supplements, especially as you get older, are going to get more expensive. These prices will vary depending on what part of the country you live in, but you will have a premium that will go up and up every year. While the price will vary depending on your age, location, and if you smoke, if you are 65 first aging into Medicare, you should expect to pay on average somewhere between $100 and $150 for the supplement coverage. Depending on what part of the country you live in, you could be looking at quite a bit more than that as well. Those premiums will continue to go up each year, and you can easily be paying $250 by the time you are in your 80s. That supplement premium is on top of the Medicare Part B premium that you have to pay for Medicare. Supplements do provide fantastic medical coverage, but the coverage does come at a price. The second drawback is you need multiple insurance cards. While this one sounds trivial to a lot of people, this is always a complaint that we hear. Why do I have to carry around so many cards? With a supplement, you have your original red, white, and blue Medicare card. You have your Medicare supplement card. You have your Part D or your prescription card, and if you have any ancillary benefits, such as a standalone dental or vision plan, you have a card for those as well. Some people could care less about this one, but for others, it's a big deal. Our third option is more of a double-edged sword. It's a reason to get a supplement and a reason not to get a supplement, and that is that you need a separate Medicare Part D plan. A standalone Part D plan is going to be an extra cost to you. While having a standalone Part D does give you greater flexibility, it can also complicate things. Frequently, the cheaper standalone Part D plans will work great if you're only taking some inexpensive generic medications. What if you take some brand name medications or generics that fall into higher formulary tiers? You are much more likely to either have a higher Part D monthly cost, or you may have a plan deductible that must be met before your plan starts covering your medications, or at least before it starts covering your brand name ones. Many of the $0 premium Medicare Advantage plans have surprisingly strong prescription drug coverage built into them, so depending on your specific situation, the way the drug plan works can either be a plus or a minus for your Medicare supplement plans. The final negative is the lack of extras. While supplements are allowed to cover things like silver sneakers, They are not going to have integrated dental or vision, hearing, over-the-counter benefits, transportation, or any of those other benefits that some Medicare Advantage plans are now offering. These things might be an issue for you, or they might not. But knowing the pluses and the minuses is important to making an educated decision. When deciding which route is correct for you, it is important to take all of these items into account. So after hearing the pros and cons, you say, "Yep, the supplement sounds good for me." The next part comes down to figuring out which of the 10 plan designs or plan letters is the right fit for you. There are 10 different plan levels that are currently available, ranging from an A to an N, as you can see on your screen. You may ask yourself, why are there letters missing? Well, a little over 15 years ago, pretty much right when I started working in the Medicare industry, Medicare Part D was created. Prior to that, some Medicare supplements covered a limited amount of prescription drugs. You look at this chart and see the plans E, H, I, and J are missing. Once upon a time, those plans covered prescriptions. Once Part D was enacted, these plans were irrelevant and have no longer been available since 2010. They also covered items such as additional preventative care and home recovery. These benefits are now part of the core of your Medicare benefits, so they were additional benefits that became obsolete. If someone still has one, they are not forced to change their plan, but it is probably a good idea to review it to see if it is still a suitable option. You may find that you're paying extra for benefits that are no longer needed. It is important to know that drug coverage built into a Medicare supplement is not considered credible coverage under the Part D guidelines. If you have a Plan J, for example, and never picked up a Medicare Part D plan because you said, well, I already have drug coverage, should you ever decide to get a regular Part D plan, you will see a sizable premium penalty. You can see my A, B, C's, and D's of Medicare video for more information on these penalties. The most popular plans right now are the F, the G, and the N. Over 90% of plans we see sold are one of these three options. The Plan F is what we call the Cadillac plan. It's as good as it gets, but it comes at a premium. As you can see on your screen on the far right side, a Plan F covers 100% of all the categories down the list. As long as you're going to a doctor, facility, or hospital that accepts original Medicare, you can expect a Plan F to cover 100% of your Medicare-approved bills with no cost to you and nothing out of pocket. On your screen, you may notice that the Plan C and Plan F are separated from the rest of the plans. Well, that's because these plans are only available to those who have Medicare Part A or Part B effective dates that are prior to January 1st, 2020. There was a recent law change that stated that new to Medicare members could no longer have a plan that covered the Medicare Part B deductible. Thus, the two plans that covered these benefits had to change their enrollment rules. Anyone who went on to Medicare after January 1st, 2020 will never be eligible for one of these two plans. A common misconception, however, is that as of January 2020, the Plan F went away entirely, as the Plan J did 10 plus years ago. And that is just not true. If you went on to Medicare in 2018 and currently have a Plan N, for example, and 5 years or even 10 years from now, you decide that you want to get a Plan F, you will be able to do so. All the insurance company will need to see is that your effective dates of your Medicare Part A or Part B is prior to January 1st, 2020, and you will always be able to get one of these plans. Seeing a grid with check marks of what's covered is great and all, but let's break down the benefits to make it easier to understand. Just like original Medicare, a supplement follows Medicare Part A and Part B. Part A covers your hospitalization and inpatient care, and Part B covers your outpatient care. When it comes to a supplement Plan F, almost every category on the Medicare checklist is covered at 100%. First, in the event that you're hospitalized under Original Medicare, you would have a sizable deductible. This is currently $1,484 today in 2021. The Plan F pays this deductible, leaving you with zero out-of-pocket for the first 60 days of a hospital stay. For most people and situations, this 60 days is more than enough. But if you stay in the hospital longer than 60 days under Original Medicare, you start to get a daily copay. When it comes to this copay, once again, the Plan F pays 100% of your bill. Should you exceed 150 days where Medicare stops paying altogether, the supplement is going to give you an additional 365 what are called lifetime reserve days. These lifetime reserve days let you go above and beyond Medicare's per occurrence day cap. Think of these as a gumball machine and you lost the key. When you take one out and you eat it, it's gone. They cannot be replenished. To back things up a bit, to make one other thing clear, days 91 through 150 of the Original Medicare benefits are also lifetime reserve days. Yet another reason why Original Medicare by itself can be dangerous. When you use these days, they are permanently used up even if you change your supplement and go from one to another. A Plan F will also give you 100 days of skilled nursing at a $0 copay. Skilled nursing is commonly confused with long-term care. It is important to understand the difference. Skilled nursing is covered by Medicare and long-term care is not. In its simplest form, when you are in skilled nursing care, it is because something happened, such as an injury or you're recovering from surgery, and you are just unable to live at home for a limited amount of time. This is most commonly going to be more your live-in rehab scenarios. But ultimately, the purpose of skilled nursing is to get you better so you can go home. Long-term care, on the other hand, is when you can no longer live at home anymore, and you need to go live somewhere to provide you with extra care. Medicare does not cover this. But Jay, a friend of mine, said that Medicare is covering their mother who just went into a nursing home. And don't worry, we hear this all the time. Most likely they misspoke. While Medicare does not cover it, Medicaid does. Medicaid is additional coverage that can be available to individuals who have very low income and few assets to their name, or in cases like this scenario, may still have more income, but have exhausted almost all of their money and resources, so they cannot afford a nursing home, but need to be in one. Moving to the next piece, if you need blood while in the hospital as an inpatient, or need end-of-life hospice benefits, you can also see that those are covered at 100% under a Supplement Plan F. So as you can see, a Plan F covers the balance of all Medicare Part A benefits, leaving you with no cost for any Medicare-covered inpatient services. Now that we've talked about your Medicare Part A benefits with the supplement, let's move on to Medicare Part B. With Medicare Part B, you will see that consistent trend down the side of these graphs as well. That nice column in red with your responsible being $0. When we look at the coverage details, first, Medicare has a Part B deductible. I mentioned this briefly before, but the Plan F and the Plan C are the only plans that cover the Medicare Part B deductible. This deductible changes from year to year and is currently $203 for the year per Medicare member. Once that deductible has been met, most Medicare Part B benefits are covered by Medicare at 80%. This is where items like your doctor visits, labs, diagnostic testing, physical therapy, surgical benefits, and durable medical equipment are covered. Medicare pays its 80%, and then the Plan F pays its 20%, once again leaving you with no out-of-pocket cost. Between Medicare and the Plan F, they will also cover any Medicare excess charges, any outpatient blood, and all lab services. Home health care is also covered at 100%. The only place where you would have some out-of-pocket expenses on the medical side of things is if receiving emergency care outside the United States or the U.S. territories. As you can see on your screen, Original Medicare does not cover care while outside the country, even in the event of an emergency. However, most supplements, including the Plan F, do. you receive foreign travel emergency coverage. First off, you have an annual deductible of $250. Then the plan will pay 80%, leaving you with 20%, up to a lifetime maximum of $50,000. This coverage is for medically necessary emergency care only. If you decide that you want to have a scheduled surgery in England, this benefit will not cover you. So as you can see, with the exception of foreign travel, a Plan F gives you 100% coverage for all Medicare covered items. With a Plan F, the only thing most people are responsible for is their prescription drug copays under their Part D plan. After reviewing those benefits, you can see why a Plan F has been very popular for many years. But honestly, over the past few years, more and more people shy away from it after receiving a full plan review. Why, you might ask? The cost compared to a G or an N. As you look down this list, let's compare the F and the G. There's only one difference between these two plans, and that's this one right here, the Part B deductible. Now, this deductible does change from year to year, and most years it does go up by a few dollars. Right now in 2021, as I mentioned before, it's $203 per year. So it's not a big deductible by any stretch. However, what if I told you that a majority of insurance companies' Plan Fs cost $400 or roughly $400 a year more than their Plan Gs? You would be right in asking yourself, did you just say I pay $400 more for my insurance to only cover $203? And yes, that is correct. Some people are okay with this, but when it's broken down like that, a majority of people are not. I personally call the Plan F the widower plan. And I do this because a lot of people who like the idea of a Plan F are individuals who recently lost a spouse, and that spouse is the one who took care of the bills and dealt with insurance decisions. I've had clients who have told me that they panic when they get bills, and it gives them anxiety when they don't know what they're supposed to pay and what they're not supposed to. Assuming that that person can afford a Plan F, could a Plan F be the right plan for them? Of course it could. $200 a year extra for someone to know that if it's a medical bill they don't need to pay it could be well worth it. Others may say, I would just rather pay an extra $30 or $35 a month to not have to worry about coming up with $200 in January if the first thing that I did in the year was subject to that deductible. And that's okay too. But you should always make a decision with all the facts instead of just saying, well, I got a Plan F because that's what Betty has, and she usually makes really good decisions. While your situation and Betty's might be the same, they also might be quite different, and that's why the right choice for one person might not be the right choice for the next. The Plan N has become a very popular option as well, mostly due to the value proposition, or what am I getting from my plan versus what I'm paying for it. If price wasn't an option, everybody who is eligible would get a Plan F. Why? Because it has the richest coverage, but you pay for it. While this varies by company and location, a Plan N is usually roughly 35% cheaper than a Plan F. It still gives you rich coverage in most of the areas that people want if they're going the supplement route, but it does have some cost sharing. Just like the Plan G, a Plan N does not cover the Part B deductible, so you have to pay that $203 on an annual basis. In addition to that, you also have to pay up to a $20 doctor copay and a $50 emergency room copay. Why would you want to give yourself a copay, you might ask? Why not just go with the Plan G? And for some people, that's exactly what they do. If you say, nope, I'm good with the deductible, but I don't want copays, then the Plan G is a better choice for you. But what if you go to the doctor on average 2 times per year and you haven't been to the emergency room in the past 10 years? If there was a $20 monthly premium difference between the two plans, which one would actually be a better value for you? In that scenario, you spend an extra $40 in copays, but you saved $240 in annual plan premiums. So overall, at the end of the year, you have an extra $220 in your bank. A Plan N also does not cover the Medicare Part B excess charges. Excess charges are not as prevalent as they once were, but we still do see them from time to time. An excess charge occurs when a doctor or facility bills a patient above and beyond the Medicare allowable amount, which is also called Medicare assignment. Several states, including my home state of Ohio, actually have laws in place that prevent doctors from accepting Medicare and billing above assignment. If you have medical care in one of these states, you don't need to worry about this at all. While in other states, doctors do have the right to bill above assignment, according to a recent study by the Kaiser Foundation, over 97% of all physicians and practitioners billing Medicare do accept assignment. Other plans outside of the F, G, and N may still work, but these three are absolutely the most popular options. Most breaks down to the cost versus the benefit. Let's compare a C versus an F. The only difference between these two plans was the Part B excess charge. But Jay, you said the Part B excess charge really isn't that big deal anymore. And while that is very true, most insurance companies that offer both a C and an F have around or less than $1 per month difference in price between the two plans. Most people who are looking for true top-end coverage would happily pay an extra 75 cents per month to not ever have to worry about an excess charge. Plans like the K or the L, while much cheaper, really leave a little too much out-of-pocket exposure for the average person who is looking for a supplement over an Advantage plan. Looking at a K, for example, at age 65, you would be looking somewhere right in the range of $50 per month for the plan, plus additional costs for a standalone drug plan. With an out-of-pocket limit of over $6,000, most people would choose to lean towards a Medicare Advantage plan when dealing with that type of exposure. I know we just went over a lot of information, and I hope you learned something today in this lesson on Medicare Supplement Basics. If you have any questions on anything you just saw, or would like to schedule a personal review of your benefits, give us a call or send us an email to the information below. As I mentioned in this video, there are so many variables with your location, your age, your needs, and so forth to really talk details on the plan costs. But if you reach out to me or my office, we are happy to go over more details based on your personal information. Any and all calls, consultations, and enrollment assistance is always 100% free of charge. At TLC, we are contracted with almost all national insurance companies and many local ones in many states across the country, and we would love the opportunity to help you out. I hope you found this video helpful, and feel free to leave any questions or comments in the comments section below. Finally, if you like what you saw today, click the little thumbs up to give this video a like, and if you want to be notified when we release future videos, click the subscribe button. Thanks for watching, and take care.